Hello.
Hey, how are you today?
I'm okay. Thanks so much for joining me here. I really appreciate it.
Sure. Sorry for all those scheduling conflicts. I apologize.
It's okay. You're a busy man.
Yeah, well,
So, really appreciate you taking the time to talk to me and to people at WJCS and those who follow WJCS. The last time I conducted an interview, we talked about mental health in Westchester, but it was pre-COVID.
yes.
So I was just interested, but we've heard so much about the skyrocketing numbers of mental health problems. I was very interested in your perspective, what you have been seeing since COVID began.
Sure. And I think we all know that behavioral health, mental health, substance use was experiencing a public health crisis even prior to the pandemic. Obviously, even then, we saw as other health related matters such as diabetes, cancer, the fatality rates went down. Unfortunately, in mental health, our suicide, alcohol fatality, and substance use deaths went up, and that was even before the pandemic. So we can probably look at what some of the issues are in terms of stigma, access to services, but clearly the pandemic has had a major impact on our county and the rest of the country. We describe it sort of as the ripple effect, what occurred. Initially, it was obviously the fear of the virus itself, the unknown, the uncertainty, not having a vaccine for months, which led to health issues and unfortunately death. And with that comes the social isolation, people struggling with food insecurities and housing. And that, of course, leads to increased depression. We saw an increase in anxiety, irritability. And that led to obviously service utilization. So we definitely saw an increase in people reaching out for services. We saw an increase in police response to people struggling with behavioral health issues. And just also just needing supports and services in a time that we were social distancing. So clearly it sort of created a major need within our mental health system.
Can you talk a little bit about the different populations who are affected? COVID was something that affected every age group and every socioeconomic group. But COVID there seemed to be a racial disparity in terms of how people were affected by COVID and sort of the mental health overflow from that. Can you address a little bit about what you're seeing? And then the elderly, of course.
Yeah, that's a really good point. And I think we definitely saw the impact on our entire county and residents. Clearly, it tends to be communities of color due to lack of access or insurance issues, or the fact that many of our communities and residents still had to go to work and do all the things to keep our vital services operational. So that's clearly not always getting the services that they need. Interestingly enough, most people who have commercial insurance don't really check their behavioral health policy, and hopefully will never have to use it. During the pandemic, we received an increase of calls for people who were on commercial insurance, never thought they would need to use their behavioral health plan, and realized how inadequate it was, or that they couldn't access certain services, or there was a limited panel. So it showed the discrepancy in insurance and health insurance and those who have access to certain service and those who don't, unfortunately.
And you've always been wonderful in terms of trying to address the mental health challenges, but were there any particular programs that were created in Westchester to address, specifically pandemic issues?
That's a really good point. And thanks to the partnership of WJCS and other agencies, and also to some funding that our county executive provided us with during the pandemic, there were certain populations that were identified as obviously being critical and more vulnerable. So some of the services we did were more general in terms of just trying to educate the community, parents, school districts on just understanding mental health. So thanks to the partnership with WJCS, we really rolled out a lot of mental health first aid training, doing it through a virtual platform, but really reaching hundreds of people who really needed those tools to really help them, a loved one, or even a colleague cope during these difficult times. We also obviously focused a lot on school-age children and also parents who were often home with their children trying to manage this new virtual school also trying to work at the same time. So we did some special programs and outreach to schools and parents, and also school staff, those who were trying to manage keeping the schools open. Another group that we found really important, and because of social isolation, they still had a major role, was the faith-based leaders. So we launched a monthly meeting with some over 60, 70 faith-based leaders. And once again, WJCS played a key role in providing the support and training. And then another initiative, and I know I'm touting WJCS, but to be honest, you guys stepped up, was our work with the 13 local colleges. Thanks to the efforts of Dr. Drew Mullane, him and I co-chair a committee that meets monthly with colleges and really helping them to look at what some of their needs are, but also connecting to mental health resources within the community. We also obviously had to address the needs of first responders and our police officers who were in the trenches, providing various types of services. So we have a first responders network that consists of peers, and we gave them additional resources and supports to really try to support the first responders and our health workers as well, who clearly had a lot on their shoulders. And finally, also senior citizens. It's often a group that, because of the technology issues, were even more isolated. So thanks to a grant that the county executive provided us with, we were able to provide additional outreach to seniors in addressing some of their social isolation and just trying to provide those essential supports.
It's pretty monumental and impressive, I have to say, since it's across the board, just about every group. So your partnership is greatly appreciated. You brought up a lot of important issues. One is, you mentioned stigma. One of the questions I had is, do you think, since there has been so much talk about mental health during COVID, do you think that some of the stigma has dissipated? Do you think people are more ready to acknowledge it? Do you feel people's consciousness, or the average person's consciousness, is raised a little bit? Do you have any sense of that?
I think the reality is, since we were all impacted in some way from an emotional mental health perspective, without question, it did bring up more conversation. It was more in the forefront in terms of a priority in helping our residents. And I think it helped to normalize some of the conversations. One of the things that we did have a platform is to really reach people, mostly through various social media platforms, but in terms of their own emotional wellness, that in reality, we all have mental health, just like we have physical health, and it's imperative that we take care of our mental health. So whether it's through mindfulness, whether it's through spirituality, whether it's through exercise, or seeking outpatient support or group support or peer support, it definitely opened the channels, and people, I think, were more willing to try some of those supports and recognizing the importance of our emotional health.
I think that's a very positive development, to see that. You mentioned mental health first aid, and obviously WJCS does many, many trainings in it, but I'd love to hear from you how maybe you can just explain it to people who may not understand what it is, and also why you believe it's so important.
Sure, and I think mental health first aid, and we always call it the CPR of mental health. And in CPR, maybe you'll use it once or twice in a lifetime. We often say that mental health first aid, it's a skill, it's a tool that you'll use on a daily basis, whether it's with family members, neighbors, or colleagues, or within a school or community setting. It really provides the average person, whether you're a teacher, a coach, a parent, some essential awareness, what to recognize when someone may be struggling with a mental health issue, whether it's depression, anxiety, or other mental health needs, co-occurring disorder, and just have those basic skills to start the conversation, not to shy away from the conversation, and open the door to make it feel safe for that person to engage in a conversation, to recognize that there's next steps that we can take, and also, if needed, link them with a professional. So it's using the language, the skill sets, and the comfort level to engage that person. So we're using it now, obviously, to help young people. There's also adult mental health first aid. We've really tried to bring it into the business setting or other settings where we have adults and need to help and support them. And there's also more recently, and again, thanks to WJCS, a teen mental health first aid, where we're giving those skills to adolescents and young adults. so they can provide support and be that first line of support to their peers. So it's a very skill-oriented, but can really save a life.
Yeah, we believe it's very, very powerful and really appreciate your partnership with it. Can you talk a little bit about co-occurring disorders? I don't know if the average person still knows that term and
Yeah,
its so important.
that's really been important, and we're proud in Westchester County, and WJCN once again has been the lead as a co-chair along with our department and the Harris Project. It's really addressing the needs of young people or adults who may be struggling with a mental health and or substance use issue, but also maybe experiencing trauma or other complexities. And it's really trying to look at that person and their individual needs and support and treat both issues. And the reality is, and the data shows, that many people who experience a mental health issue may self-medicate, may turn to substances or alcohol. And the reality, if you have a substance use or alcohol issue, it can lead to depression and other mental health disorders. So why not treat the person as a whole? We're trying to build competencies in all of our systems. So wherever that person goes for support and treatment, there'll be competent care and an understanding of mental health and substance misuse. So Westchester is really leading the way, I think, across the country, not only the state, but country, in developing capacity, use of evidence-based practices, and really recognizing the co-occurring exist in people who we serve.
Yeah, it's definitely another matter that needs raised awareness, increased awareness, and I think we're getting there slowly but surely. Let's talk a little bit about the workforce. There's been a lot in the media about, quote unquote, the Great Resignation. First, there was tremendous concern, of course, about job insecurity, people losing their jobs during the pandemic. And then suddenly we hear about people not wanting to go back to their jobs. So it's a bit confusing for people because, one, generally people need to earn an income. So what is your perspective on all of this?
Well, clearly the pandemic has impacted our workforce, and we are in the field that is often in the lead in providing support and healing to others. But obviously during the pandemic, we were all impacted. Life kicked in, and we had our own issues of taking care of our loved ones and family members. So it really does become a challenge. How do we meet our own needs as helping professions, and at the same time trying to serve a population that really needs our support during such difficult times? And I'd be remiss if I didn't mention the fact that many of our staff were continuing to work in the front lines, working either in a residential setting or in a hospital setting, where they truly had no choice but to continue the work efforts. And obviously we're in a field that it's often about connections and engagement and personal relationships, interrelationships with our clients. So the fact that we had to go remote obviously presented with great challenges. And thanks to the state, we were able to use telehealth. That was long overdue. And for many, that was a real tool during such a difficult time. So we hope that we can continue this practice as a tool, but obviously want to get back to providing direct services in person. But I think, again, just in terms of how much of a priority mental health, substance use, and developmental disabilities is, how do we value our workforce? Is there going to be equitable pay and support? Maybe through this pandemic, there'll be a recognition that we truly are essential. And that's why I don't use the word primary health. I use mental health is just as primary as physical health. So I'm hoping that that recognition is finally achieved. But clearly, we still have a long way to go in terms of workforce and supporting the important work that our staff do.
Is Westchester working with business leaders in terms of helping them help their workforce re-engage for the people who are uncomfortable about coming back? How involved are we in that?
That's a really good point. I think quite a while ago, when the reopening first started being talked about in terms of schools, places of business, government, we made sure, and we did a lot of outreach and conducted a lot of trainings and presentations to businesses on, just as you put together a health and safety plan, it's just as important to have a mental health or emotional wellness plan. Either whether that's providing universal support, could be incorporating mindfulness in the office, or trying to be more sensitive to what people may be experiencing, all the way to providing specific resources, employee assistance programs, or connections to agencies such as WJCS. I have to say there was a great deal of receptivity. I think most businesses understood the value in some of these programs. I'm hoping that interest will continue over time, because as things usually come and go, hopefully mental health and the wellness of the workers will be valued. And also there'll be an investment in terms of the long-term care as well.
That would be terrific. That would be terrific. You mentioned earlier about teachers and schools and working with them. I would imagine, despite all these challenges, you've seen a tremendous amount of resilience in people.
Yes.
And could you talk about that? This has been a challenging time, but people have risen to the occasion. And what is your perspective on that?
I think it brings sort of some of the common elements that we all experience in terms of fear, in terms of loss, in terms of grief, whatever that may feel like, whether it's a loss of a loved one or a disappointment or some experience that kind of bonds us together. And I think that does bring out the resiliency in people. One of the things that we've really tried to promote during the pandemic is sort of the 3 pillars of trauma-informed care. As human beings, we all want to feel a sense of safety, a sense of connectedness, and also being able to self-regulate or cope. And I think we all, whether we're a mental health professional, whether we're a spiritual or faith-based leader, or whether we're parents, those are 3 pillars that we all can play an important role in. So that became sort of a common theme also as a society, as a county, as communities. How do we help each other stay connected, feel safe, and help each other cope during such a stressful time? So how that was exhibited, the different things that occurred within communities and families really was quite powerful.
Yeah. So just looking forward, of course, 2 years ago when we looked forward, we didn't know what to expect. But looking forward, what are your hopes for Westchester in terms of continuing to meet the mental health needs? What is your wish list for Westchester? Where do you see us going?
I think we're fortunate to live in a county where there's great leadership. Our county executive has really invested resources. He has allowed us to talk about mental health and put it at the forefront in our priorities during this pandemic. I think we're also in a county that has tremendous leadership and organizational leadership. Agencies such as WJCS has been around for a while. There's an investment where you guys are embedded throughout our communities. So those services hopefully will become even more critical. And thankfully, there is a vaccine that obviously is helping address the virus. But unfortunately, there is no vaccine for the long-term impact that the pandemic has had on our emotional wellness and mental health. So it has to be not only a short-term investment, but a long-term investment in terms of helping to build our mental health resources, the long-term impact, the impact it's had on disenfranchised communities, the impact it has had on the socioeconomic status of our families. That investment hopefully will be there for quite a long time. And I think also acknowledging and recognize the importance of the work that our human service mental health providers provide, that it's recognized and that it's supported and that it continues to be a priority as we move forward.
Well, thank you. As usual, you have made so many excellent points. Really appreciate your insights and your observations, and most of all, your leadership, which is so integrally important to basically every Westchester resident, whether they know it or not. So thank you so much for your time and for all your great work and your partnership with WJCS.
Well, we definitely appreciate the partnership with WJCS and the wonderful services and staff. So thank you.
Thank you. Take care.
Bye-bye.